start here and jump in with a question from a viewer who watches quite a bit. Hi, Dr. Doreen. My son is 3 years, 10 months, has been with CARD for 10 months. He used to script ABC show. He scripts shows. It's out of control. Also, the echolalia is massive. We thought he scripted when he was nervous or when asked to do a task, but now he does it throughout the day. Yesterday, I noticed that he repeats his answer, for example, yes, 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 yes. Seriously, where did this come from? I'm not understanding why this is happening if we keep providing him with alternative speech. Is there something medically that increases this behavior? He's on a great diet, biomedical intervention, and he sleeps great. I'm so stressed because this is conflicting with therapy. When we call his name, he looks at us and says, no silly talk, but yet he continues. Please help.
So your CARD client, I should probably have our clinical director, Evelyn Kong, talk with whoever your supervisor is. This is not, scripting of this nature is to some extent avoidance behavior, because you will repeat something and that will delay the actual answering or responding to whatever, performing the demand that's being asked. But no silly talk won't work. At this point, I think we need to change intervention and most likely start timing the duration of the answer and only teach him to discriminate between one answer versus numerous repetitions of the same answer. Don't worry about it. I always say echolalia or scripting or verbal stuff increases and then you shape it. So it makes sense that it would increase. He's getting a lot of intervention, I assume, right now because he's a young child. And so part of that is in the beginning our kids start to respond sort of a lot, and then later you form it into the appropriate type of response and interaction. So initially it's just a bunch of stuff, and sometimes it seems very robotic or very repetitive or out of context or all these different things, and those are the things we fix. But it's not a major thing. It really is a different, this is the number one thing I would tell your supervisor, is to actually visually prompt one-word response versus multiple-word response. And so you ask him, and I don't know what his lessons are, I would throw it into one of his lessons, actually, verbal imitation or something. Or I don't want to do it in verbal imitation. I'd actually do an expressive response like labels or something like that, and then you would require him to respond with one, and you'd stop it. You'd literally stop him versus many, and then he would say it many times. He'll get the difference. He'll understand when you repeat something versus not. So don't be concerned. This happens quite a bit, and we can fix it. So I would suggest that you just have your supervisor send me an email.
There you go. Great advice. And I just want to remind everybody that it's a natural course of things that as parents, we get anxious about a new behavior or something. And it feels like, I once described it to our supervisor that because my son lost skills at some point, any time where we would have to go back over something that had been in maintenance and had to be brought back into a program, I would have
that is the scariest. Absolutely. And that is a very scary experience, much more scary than what you're going through, what this viewer is going through, because when your child is accelerating and then suddenly they stop and start losing stuff, then you really get concerned because you're wondering what's going on with their memory. Why aren't they retaining? But it isn't. It's sort of like growth spurts. Yeah. You know how your kids, typically developing kids, they will, they'll have periods of time where they're eating, and they grow this way. Yeah. And then all of a sudden they'll grow that way. So it's the same kind of thing. Their language will expand this way, and then we shape it to what it should be.
Yeah. And so I just want to say to you that it's normal that we as parents have anxiety when things are doing all those wonky little twists and turns. And it's really good to get yourself in a good support group with parents that you can talk about so that they can hold your hand too and say, we went through that, you're going to get through this, it's going to be okay. Because if I could do one thing over again, I used to say this about my pregnancy because we had a miscarriage, and so when we were pregnant with Jem, I was worried the whole time. And if I could do one thing, I would go back and not worry and know that we were going to have a baby and that it was all going to be okay. If I could do one thing about autism, is go back and look at all those times when I was such a worried mom that I wasn't seeing what was happening, and have a worry-ectomy.
I know. I think we all feel that way, though,
Really?
with our kids. Well, I mean, I don't just think about, I wish I could go back and stop worrying, but I also think I wish I could go back and, I guess, not take it too seriously.
Enjoy.
Yeah, enjoy more.
The moments.
Yeah, enjoy
I love
more.
watching the A Word now, because
Right.
I watch as Jack Riley goes through things, and I get to feel the joy of it, because when my son would hit milestones, I would be so busy worried about the next thing that sometimes
Absolutely.
I didn't quite celebrate the moment.
I can understand that. Understand that. And I, as a behaviorist, sort of had this feeling that my kids had to be what I need them to be, and if they weren't, then that meant I wasn't doing something right, and that's not a good thing. So, but and that's fine, because thank God it all worked.
And they're perfect.
And they're great. But it was stressful. Some of it was stressful. Like getting my little one to sleep was stressful. Getting my middle child to eat was stressful. Some of it was just like, okay, this isn't actually happening as easily as it should. It's taking more energy than I wanted. But,
which is really the reality for all of us.
Oh, absolutely, yes. Everything is exhausting. That's why I always say, like with our supervisors at CARD, I'm happy that they're aging, because they're all having kids and they're all beginning to realize how difficult it is. This stuff that we tell parents, you really need to live it.
Yes, you do.
Yeah.
But anyway, so let us know how things go, and make sure that you email your supervisor to talk.
Please do, because now it'll be in my mind, and if I don't hear from a supervisor, I'll be concerned.
Okay.
So, yeah.
All right, there we have it. Okay, next question. Good morning, Shannon and Dr. Doreen. I love your show. We're trying to reduce the amount of time my adult daughter spends in the bathroom at day program and at home. She has a timer set for 15 minutes, and she takes it in with her. But when it beeps, she just ignores it and says she's hurrying and can be in there for up to 45 minutes. At day program, she's in a stall with just a toilet. How can we get her to respond to the timer? And thank you.
Well, and thank you. That's a good question. And I appreciate that they're trying to use a timer, but the timer is useless unless someone actually forces her to exit at the time of the timer. So you now have two choices. You either need to, and I don't know her size, but she's an adult, so this might be difficult. You basically now need to do one of two things. Either you have an individual access her, and I mean get into the stall, physically maneuver her to get up and get ready and leave, or come out at when the timer buzzes, which is 15 minutes. So this is option one. This will result in her not being too thrilled about it, obviously, and she will probably have a little bit of a tantrum or so, and it doesn't really matter. Then you need to ignore the tantrum, maneuver her through washing her hands, for instance, and then give her a pretty significant reward. So that's one way to do it. Another way to do it is to get a baseline of where she actually is right now. You said 45 minutes sometimes, so you would then have to have one of the people or someone measure the time over the course of a week. Every time she goes in. Then you'd have 10 or 15 measurements, and then you would average those, and that would apply a new timer. Use a new timer, because that's pretty much lost its stimulus value. It's not a signal to her anymore. She just learned to ignore it. So the second procedure I'll go on, now you have a baseline, so let's say on average it's 30 minutes, or on average it's 40 minutes. I don't want to pick the longest one, which is the one you were talking about, but the average. And then now you have a new timer, and that's you keep the timer, and so she goes in, and when it hits, let's say 30 minutes, you will ring the timer, and then you will go in, get her, and bring her out. The next day, same thing. The next day, same thing. And very gradually, so like let's say the second, third day, you make it 29 minutes. The fourth, fifth day, you'll make it 28 minutes, 27, 26, and you will gradually reduce the timer, but it is always, it's still under your control, and you are still going and actually getting her to come out, and you're gradually reducing the time frame to the time frame you like, which, by the way, 15 minutes is a little bit too long too. But anyway, you pick a time that's appropriate, and the key, and then when you hit that, obviously you now will really reward it, and now you will hand her the timer, and then you will make sure that it occurs when she has the timer, and you will always reward her for staying with the timer, and then you will gradually reduce the rewards. Now what I'm trying to say is there's some key features to what you tried to do that were forgotten, and that's why the procedure lost effect. One key important factor is that the timer, responding to the timer has to be rewarded. So when she's and if she doesn't respond to the timer, you need to go back and make sure she does. Okay, so that otherwise, if it goes once or twice that she's not responding to the timer, and nothing happens, she's learned that the timer doesn't matter. Right. Okay, so but the way to keep the timer effective is that initially, every time she responds to the timer, and initially keep in mind you're making that happen, you're modeling it. Then gradually you're just standing there, and gradually you're standing further away. So, and then gradually you're outside the door and you're just timing it, and you want to make sure that what happens is you start with what's called a continuous schedule of reinforcement. So you will reinforce every time that she meets the timer. Okay, great. Then you'll gradually start to vary that. So you'll not first reinforce every second time, then you reinforce every third time, then you'll reinforce every second time, third time, fifth time, fourth, and that's called a variable ratio schedule of reinforcement. And it's the most effective that never extinguishes. So in other words, she will always think, I need to respond to the timer because eventually that reward's coming, and she won't know when it's coming.
I call that the slot machine reward.
Exactly.
Because you don't know when it's going to hit the jackpot.
That's exactly right. Slot machines
but you keep putting the quarters in because you know eventually you're going to get rewarded.
Slot machines are on a variable ratio schedule.
That's
exactly right. So that's what you need to do, and then the timer will really never lose value.
Okay. Great advice.
It's a little bit tough, and if you... that's the kind of thing that behavior analysts are pretty good at, this type of stuff. So if you know a BCBA, they can really assist you in terms of writing it out for you.
Well, and she's in a day program, so hopefully there's supports that can help carry it out. I know it's questionable sometimes.
Yeah, we train people in various day programs, and it takes half a year just to get them to comply with what we suggest. It's hard.
Make them take the RBT. I'm doing the RBT right now.
Are you doing it?
I am.
Good for
very
you.
Slowly, because I got a couple other things on my plate. But I'm very slowly doing it, and it's so good.
It's fun. You know this stuff, Shannon.
Oh no, but I'm learning new things.
Well,
I'm
good.
learning
That's
new things.
Great.
It's really good. But you could encourage somebody at the day program to do the RBT and say, hey, and the benefit is you're going to get, you'll be a registered behavior technician, and then they'll be better at dealing with these kinds of things as well.
Are you doing it through IBT?
Yes.
Oh, good.
Oh, of course, through IBT. ibehavioraltraining.com. Oh, awesome. The videos are so good, and I'm learning so very much.
That's wonderful.
It is wonderful. In any case, we're going to take, and you can find that, by the way, if you want to do the RBT, it's at ibehavioraltraining.com, and there are different settings, but there's one for RBT, which stands for Registered Behavior Technician. Really so informative. We had a question last week about hair cutting, and so they said the haircut question follow-up, and they go on to say, my son was obsessed with long hair when he was younger. The haircut thing, because all he's wanting to do is cut hair, for those of you who weren't here last week. And I believe he was 13, if I remember correctly. So she goes on to say, the haircut thing started seeing the transformation of a celebrity from having long hair to super short hair. Then he YouTubed cutting short hair. Tonight, tried the paper cutting craft, because that was one of the things that you had recommended, is instead, give him something else to cut. And then she goes on to say, at the end, he still snipped at the paper, pretending he was cutting hair. We also did some paper fold cut test problems, which we happened upon on YouTube. Those sound kind of fun. That kept him engaged for a while, and we tested the solution by folding and cutting. Still can't figure out the function of this behavior. If he is engaged somehow, the behavior is temporarily gone. Would it help if we do a social story of the weirdness factor, but also don't want him to feel shame, working on boosting his self-esteem? We also tried to get him to trim the shrubs in our garden, didn't fly. We'll try will continue to try different textures and maybe just keep him busy. Because that was one of the things that you talked about last week about finding the thing that satisfies, the thing that's the right texture that satisfies the desire to cut hair and channeling it in a good way.
Right. And you have to understand it could be a completely different function. Like this is when I wish I knew these kids that you write in about. But he sounds pretty high functioning, and you should go back to looking at, like, thinking about that celebrity haircut and what occurred with the celebrity haircut. I'm not sure if the celebrity, I assume, was very thrilled or happy. I mean, he could be wanting to play the role of the hair cutting person in that video because they were, I don't know, applauded because they got a lot of attention. He could be trying to, thinking that by cutting hair, he's going to make the person happy. I'm not sure what he's... So in other words, the function of behavior doesn't necessarily have to be a sensory one. It could also be how it makes him feel. So you just need to think more about that. And I can't really advise you more because I really don't know and I'm not there to see it. But do consider, if you do write a social story, I wouldn't really write a social story about it being weird. I would write a social story probably about how an individual might not like their hair when it's cut. Oh. So in other words, sadness coming about from it. Okay. Because if he has empathy, then he will probably not want to do it after that.
Okay, very interesting.
Yeah, like being disappointed with the haircut or something like that. Again, I would do whatever is the opposite of that video that he saw.
So keep us posted and let us know how that works for you. I want to do another follow-up here. Hi, Shannon. Thanks to you and Dr. Doreen, we signed on to Skills.
Oh, awesome.
What a comprehensive tool that breaks down skills needed into manageable steps. Can't wait to get started on the actual work. And they go on to say, this is the 13-year-old 8th grader on the giggle advice, the person who was giggling a lot last week. Dr. Doreen said to put a timer on the task. Mm-hmm. This time it wasn't giggles, but clear task avoidance, and it was piano practice. Told him to give a strong 5-minute focus and done. And she said, wow, he did and started to enjoy the music too. Follow-up question on social skills. Should we work on acquiring the skills first or get them in a group setting as much as possible? Watching some of the other videos, they said, you asked great questions, Shannon. Thank you. Temple Grannon, Eustacia gave a lot of food for thought. Amazing work on the archives, which is mostly for Emily. Listing Dr. Doreen questions and marking the time when the question is answered. Thanks for breaking it down to make it easier to digest. You give us hope, and thank you. I don't know if you know, but every time you answer a question, it has a time code. So for those of you watching it on the YouTube, you go to the top of Ask Dr. Doreen. It lists the questions, and when you see the question you want, you click on it. It takes you right there.
I know, it's fabulous.
It's a lot of work.
Really, Emily has done an amazing job with that.
It is amazing.
So I would say that completely lost what the question was. There was like 50
because there was a lot of things in there, but they loved the advice. But the social skills.
That you're into skills. Like, I'm very, very excited about that. You sound like the type of parent that will really enjoy skills, and it is a very comprehensive tool, and it's very complicated. And a lot of times, I think people give up because it's so complicated. But a human being is complicated, and we're trying to help parents and users teach everything that a child needs. So that's number one, and I'm really thrilled about the fact that you're involved with that and that the timer thing worked for you. There was one question in there
about social skills. About should I start working on the lessons first or go to the group setting?
Yeah, I would really start working on lessons first. My personal, and so. And I'm not implying that you should work on a lesson or number of lessons and then keep your child isolated from everyone for the next year until you manage those lessons. Not at all. But it's kind of, both are good. So it's sort of like learning a second language. You want to have some basic skills, and then of course being infused in that activity or in the community or in the city where they speak that language is also extremely helpful. But if you don't have the basic skills, being thrown into a community of people who are speaking that language becomes frustrating and aversive. So it's the same type of thing. It's like if you're going to throw your child into a social setting, at least teach some of the basic understanding so that and introduce the child in small spurts. So, kind of what we do is, obviously we have usually the benefit of having a lot of intensive hours. So I'll work, let's say, intensively on a concept, like, let's say I want to do social communication. So I'll do social communication, and breaks into several different lessons, right? So there'll be lessons about, how to approach so it has prerequisite lessons as well. This is why skills become so complicated. So, my goal is for my child to go into a school's playground, to join a group of kids and converse with them appropriately. That's my goal. Now, this requires several different sets of skills. The first being my child has to identify the group and actually listen. And when I say identify the group, that means my child has to identify these are the people I want to become friends with, or these are people I want to interact with, and actually be able to listen to what some of their interests or subjects are, so that and then actually be able to come up with some topic that's fits into that area or is of interest. And then once you've done all of that, and that's sort of setting stuff, it's kind of identifying the setting, identifying the audience, all this kind of pragmatic stuff. Then once you've done that, then the child has to be able to identify figure out how to introduce a topic and join the group. So join the group, introduce a topic. So I can teach my child those things and then practice that, right? But then I should probably be nearby, because I still haven't taught my child things like, what if they make fun? What do you do then? What if they all look down and start walking away? What do you do then? What if the topic changes? What if nobody's interested in what you're talking about? So there's all these other things that I will teach you, and they're all part of social communication, and they're coming. They're SD4 and more advanced parts of that lesson. But for now, I just want to make sure what you practiced was successful. So you kind of can infuse the person, but you need to give them some basic social skills first. And by the way, please also make sure that you do when I integrate or mainstream my kids, I will often I want the other kids to know, because it's much more important it's much better if they know rather than they don't, because you tend to have a tendency for children these days still to bully and to mock when they don't know. But when you talk to them ahead of time, the other kids, and you say, he has issues with language, this and this, and I need you guys to help me because this is what I want you to do, and so on and so forth, then they actually become what we call confederates, and they sort of join the team, and they will then really work for you. And so I think those types of things are very important as well initially, because by the time your child will change schools multiple times and eventually will have the option of being with kids who don't know his or her history. But when you're introducing an individual to social settings, it's very important that the everything go right, because if you have a circumstance where the individual kind of has a bad experience, it's harder to change that and fix how it made them feel.
And kids are so much better at this than adults are.
Oh, yeah.
When you say to a kid, hey, can you help him out because, and you don't have to disclose everything, right?
Absolutely.
You don't have to tell him, but if you say to a kid, hey, can you help him out because he needs some practice in doing this, that, and the other, the kid is on it. The kid doesn't ask you questions. So what exactly is the diagnosis and what do you do? The parent will, but the kid goes, sure.
Sure, I'll help,
yeah, absolutely. Yeah. And they're so much more open and accepting. Kids are great.
Yeah.
It would be great if we could all stay in kid mentality, right? And because they're so accepting. They accept what is.
Yeah.
We rail against it and try to package it. And
it really has to do with kids reflect their parents to a large extent, right?
Really?
So I think so. And I think that kids can be not so great if they haven't been treated fair or well.
True. That's absolutely true.
Yeah.
But we wish you luck with that.
Yeah.
Thrilled that you're working on skills.
Yeah, enjoy.
I never disagree with you, but I'm going to disagree with you on one thing.
Please.
I don't think that skills is complicated.
No,
I
okay.
think that skills is complex. And I think that when we talk about it being a tool, I want to talk about it more about being a toolbox.
Yeah.
I think that what happens is when parents go to it, they go, I'm not sure what to do first because they don't know which tool to use.
Right.
And so, like, the hardest thing about skills is there's so many things there to use that you may not need them all.
Yeah, it's crazy.
And then you pick which tool you want to use first, and then later on you can use the next tool.
Right.
But I think once you pick a tool, there's nothing complicated about it.
Right.
It's just that there are so many tools in the toolbox.
It's true. And you know, I really would like to, this is on our help desk ticket, right? It's a ticket. I want to change the whole look of skills, the website entry, you know, the what is it called, the dashboard, because I do think that there are ways that you can make it more simple for people to understand. There's a lot of really good stuff, and it's all sort of listed on the left column, and you don't really you don't even see where it says progress charts. You know, there's so many good things, but quite honestly, it takes a lot of money to fix the look of these things and change a dynamic web feature like that, and so it's kind of on hold. But you know, and if there are any viewers who are people whose specialty it is to do that, please contact me. We can use your help.
There we go.
I really do want to change the design though and the look of it, because I agree with you, and I think there's just a lot on there. For me personally, if it was my child, I would really want to I would love to be able to make my own dashboard.
Yeah.
Like be able to put on there all the graphics that I want, where I want to see, when I open it, I want to see his behaviors, and I want to see his rate of acquisition, and maybe I want to see all the medications. I don't know. I would be able to make my own, and maybe appointments, and then, you know, all the things like that. I'd really like to have that.
That sounds wonderful. All right. Well, I hope that happens. And if you're somebody who is a great graphic artist, web designer person, be in contact. Okay, moving on to, we were just talking about a 13-year-old. We're going to go to the other end with a kindergartner. Somebody wrote in and said, to spare my kindergartner from being bullied or being labeled weak by peers, how can I give him a survival checklist of who to avoid? Yesterday, I hurt his feelings playing back my interpretation of a play period with a child in his school. I saw that despite my child verbalizing, because they said, yay, his desires to have the other child take a turn to be it in the very long game of tag, the other child would not give in and eventually started to become verbally aggressive with my son, saying shut up and some gruesome things he would do to my child. My child seemed to think that it went rather well, and they wrote, Yeah, it's gosh, you know, I often say that our kids are so sweet. They just never learn, you know, meanness of any kind. I don't know that I would. I mean, you can certainly. It's to me, it's harder, and it's early. It's harder to teach your child how to identify, I guess, bullying or mean behavior towards him. It is a very hard thing to do, and I'm not sure I would do that. I would wait to do that until much later. I would really not do it in kindergarten. I really wouldn't, because it's you're pinpointing the faults of human beings, and I don't want your child to learn those things, because our kids, you know, our kids on the spectrum tend to just be the sweetest and loveliest people, and they're very pure in some ways, and I don't want to really say these are horrible things you should stay away from. And believe me, if he starts to, we do tend to stay away from things that we recognize as being bad. You don't really want him to misrecognize now and start thinking all kids are bad and I should stay away from them or they will hurt me. It's better if he's still interested in kids. What I would do is I would go in and try to change the kids. That's what I would do personally. I would go talk to the teacher. I would go in, I would give really
major lecture to the whole class about bullying, about what it is, what does autism mean. I would make sure that the other kids understand that autism doesn't mean mental retardation, that autism means special types of skills, that autism, that children, that people would, I would actually show some of the people who have ridiculous talents, you know, like the person who can draw visual maps from an airplane, or the person who is like amazing on the piano. And so I would find 4 or 5 of those things on YouTube, for instance, and show them to the whole class. I would present the cool side of autism, essentially, and then I would specifically point out, like, the other day this happened. You wouldn't necessarily name who it was, but they would know who they were, and you would make sure to, like, say, so you should give the kids some sort of reinforcer and say, so when this happens, this is what you guys can do to help. These are ways you can help him. And I would really seriously do that. I mean, and you might, obviously you don't want your child to be there that day, perhaps, but I would really work on the other kids, because I've seen classrooms where other kids become your friends, and I guess they join your team, and they really, really want to help, and oh my God, it's like you have 10 little helpers all of a sudden. And then I've seen classrooms where there's a lot of bullies, and our child either does recognize that they're bullying him, which depresses our child, or doesn't recognize that they're bullying him, which, in some ways endangers our child. So this is where you need to intervene, and I think it's important to talk to the teacher and try to talk to all the class.
I will say that for Jem, it was later, it was in first grade, that they worked on, there's a lesson in skills called levels of friendship.
Yeah.
And that was helpful to him, but it was a little bit later. So maybe that's down the road for you, where he could identify, because he didn't want to hate one of the kids who wasn't nice to him. But what he identified was that that there were levels of friends, and that he had good friends that he could trust, and some friends that were just friends that you say hello to.
Yeah. So levels of friendship has actually also like acquaintances and friends, then family and parents and so on, and it does show you that you have different levels. And really, if your child's understanding is at that level, great, go ahead. But I caution it, because it just concerns me that, because you never want to really teach your children too early about the bitter aspects of life.
Yeah, absolutely. I agree. Okay, so we've got a question here about a 7-year-old. Hello, Shannon and Dr. Doreen. My daughter, age 7, is freaking out, in quotations, when experiencing different emotions, especially when things break, fall, or someone sneezes or coughs in a class or in any environment. Not too far ago, we were working on using her nice words, so we were told not to pay attention to bad behavior, but we are not sure how to address her freaking out, since it seems she is in distress without giving negative attention. Any help, please, is greatly appreciated. You're amazing, and we truly love you.
That's so nice. Thank you. I would need to know a little bit more about this. So what I'm envisioning, help me, Shannon, you often interpret these things appropriately. So let's see, she's freaking out, which I don't really know what that means. When she
sounds like it's attached to, because she says when things break, fall, someone sneezes or coughs, which to me all have a disruptive sound.
Yeah, exactly. Sudden entrance of a vocal stimulus. But I don't know how she's freaking out. Like, is she showing fear? Is she... well,
it says she appears to be in distress. I wonder if it's a thing where there's a scream and a covering of ears.
Exactly. So in other words, her startle reaction is dragging on, or is a little bit too intense. That's kind of what I'm getting from it. Okay. So, and if that's the case, habituation is the way to deal with that. So you basically will give her control. So you would record each of those sounds, and then give her access to a recording where repetitively, right? So the sound has to be repeated within, let's say, so you would have, let's say, a cough, and then wait maybe 5 seconds, and then another cough, and so on and so forth. So she has the ability to increase or decrease the volume herself, and she can control by playing or stopping. So once she has a little bit of control, then you just increase the duration of time and the volume. And cough is probably one of the lowest in terms of startle. The other, sneezing, if it's someone who sneezes really loud, gosh, it startles me too. It's one of those things I can't handle either. It's like, there are people who sneeze really loud.
Really loud.
So that's essentially, you give her control and you allow her to gradually habituate to the volume, so that you will increase the volume gradually. And I would say, what was the other one? Sneezing, coughing?
Something breaks or falls.
Breaking and falling. It's all startle reaction. It's all just startle. And, there's the behavioral component of it is that the more she's exposed to it and the more control she has over it, she won't panic as much when it happens. The other side of it is that physiologically, that sympathetic activity that your autonomic nervous system triggers when you're startled, and that's when you go into that fight or flight mode, right? So you will need to teach her ways to deactivate and to activate the parasympathetic and to calm down. And so, strangely enough, believe it or not, one of the things that activates the parasympathetic is body rocking. I'm not saying teach her how to body rock, but teach her a calming mechanism. For instance, walking away and deep breathing and counting. Literally, when people will just put their head down for a few seconds and then move up, or stretching, that sort of stuff. Teach her to de-escalate, because she might just physiologically have a very, very rapid activity of the sympathetic nervous system. Yeah.
Wonderful. All right. I've got a big, long question that's going to take a minute. So do you want to take a break first before we get to this? You want to dive in?
Let's go for it.
Okay. Okay. Hi. Can you help break it down for me? What's the difference between DTT, NET, FBI, PRT, and RDI? Trying to get started on skills. We used to do ABA, and it was just called ABA years ago.
Awesome. Hold on. Let me write all of the ones down.
Okay. So it's DTT, NET, FBI, which I think they mean...
Fluency?
No, I think they mean functional behavior
assessment.
FBA.
Okay.
I think I always say FBI and get it wrong. Sometimes it's FBA. I think that's what they mean. PRT and RDI. Trying to get started on skills. We used to do ABA. It was just called ABA years ago. RDI wasn't listed on skills, but figured you would know. Thanks for sharing your immense wisdom.
Oh, thank you. Okay, here we go. You ready?
Yes, right. Strap in. Here we go.
Let's talk about RDI first, because it's not part of ABA.
Okay.
RDI stands for Relationship Development Intervention, I believe. It has nothing to do at all with ABA, and it is a technique, or I don't even know that I would call it a technique. It's a sort of a protocol that was developed a few years ago, and the concept of it is that you essentially, it's a training that the person teaches a parent how to engage with the child and develop a relationship with the child. So, I don't know all that much about RDI because I'm not RDI trained, but really it has to do with various things that you as a parent would do in order to kind of engage the child, get into the child's world, and then try to get the child's attention that way, and then have the child kind of come into your world. And I think that's probably the best I can describe it. Do you know more about RDI that you can say?
I know some people who have done it, but I think you've hit the nail on the head. It's really looking at it from the parent point of view, and it's training the parent.
Right.
I think that's the key.
Right. So, and I will tell you, if I was starting with my child and trying to figure out what to do, I probably would not spend too much time on RDI. I would head straight into ABA, which is the science that has been approved, which is why it's funded. RDI is not funded. ABA stands for Applied Behavior Analysis. The concept of ABA is basically that if you want to increase a behavior, you reward it. And if you want to decrease the behavior, you remove all possible rewards from it. It is really that simple. A whole ton of different procedures have been developed around this concept of operant conditioning, which is, anything that's rewarded will increase and anything that's not rewarded won't increase, will decrease actually. And so all of those techniques fall under various types of ABA. DTT, discrete trial training, was really the first form that was studied and published, and that's what we did with Lovaas in 1987. If you want to learn more about that, you should pull up the 1987 Lovaas, Lovaas study, which I don't even remember the title, but it was
the Young Autism Project, isn't it?
Well, that was the project. That was our clinic at UCLA. Originally it was called the Young Autism Project. Then we changed the name of the clinic and called it Clinic for Behavioral Treatment of Children. But the paper was called Normal Intellectual and something else functioning in children with autism, or something like that. And it was, if you just Google Lovaas 1987, it'll come up. It was the #1 paper that changed the whole world of autism, really.
And you were there. You were.
We did it.
That.
We were. Yeah, I was one of the. I did a lot on that paper actually. And if you can find the videos. There's films. You can order the video. And it shows all the kids, and it'll show how we did intervention, and it shows the results. And the results of that study showed that 47% of the kids recovered from autism. We only did DTT. That's what we did in those days. And DTT is a procedure. It's called discrete trial training, and the procedure is very, very basic. So I want to teach pen. What I do is I place the pen in front of the child initially, and this is just an example. So this is what's called let's say, a receptive lesson, and it would be called receptive labels back in those days. And I will put the pen in front of the child, and I will say touch pen. That's an instruction. We call that instruction an SD. So the first portion of your instruction is SD, discriminative stimulus, which is written in ABA language, SD. So touch pen is my SD. That's sort of the instruction. Then I give the child a certain period of time to respond, and then the child will, let's say, not touch the pen. They'll be looking around. And so I now have to finish my trial. My trial started with the SD. Mm-hmm. The child's response or non-response is the R, which is the response. And then I have to consequate it with something, which would either be good if the child did the correct thing, or no, which would be information to the child that you didn't get it right. Now that's the basic discrete trial. And then there's other features, obviously, which is I would put it closer to the child. I would take the child's hand and put it on it when I said touch pen, and those are called prompts. So the discrete trial really consists of an SD, a response, and a consequence, or an SR, reinforcer, a stimulus reinforcer, and then various other features like a prompt that's attached to the SD and so on. So you do that. So essentially discrete trial training is you take everything you want to teach the child, whatever it is, small or big, mega lessons that could be advanced social lessons, and you break the whole thing down into very short and concrete and specific discrete trials, and you teach them using that technique. The technique requires, the one that we used to use back in the Lovaas day, was that you would introduce, and this is the original discrete trial, you give the child 2 times the instruction, and if they don't get it correct, you prompt on the 3rd trial. This makes sure that the child will receive a reinforcer, will be correct every 3rd time, so 30% of the time, so that they don't get too upset or disappointed in themselves. So that's what a discrete trial is. Now, there was a lot of criticism about if discrete trial will generalize. In other words, if it produces kids that look like robots, or if we are able to teach the kids to actually use all these skills in a natural environment. And so one of the things was that once the child had learned, for instance, the stimulus that I was teaching in discrete trial, then I would want to make sure he can identify the pens of different types in different settings, and it was given by different people, looking differently, would know what the pen is used for, with all these other things surrounding it. And so in order to do a lot of that sort of stuff, people started doing natural environment training, NET. And natural environment training is just a generalization procedure. It's sort of, you take a series of the things that you've been working on in discrete trial, and you will now introduce them as they appropriately appear in the natural environment. So it's, in my mind, if you just do natural environment training, you're slow, because you need to do discrete trial in order to be able to teach things fast and then to generalize them using natural environment training. So that's kind of a phase after discrete trial. Pivotal response training, PRT, is a procedure of picking the most, or what's called the pivotal response, or the response that is probably the most critical or crucial, or the one that actually causes all other responses to change, and teaching that one first. And so these are, if you want to know more about, so it is also a type of ABA, and anything that depends on modification of the antecedent or consequence is ABA. Anything where behavior increases because you reward it is ABA. So pivotal response training is ABA, and you can learn a lot more about that just by looking up pivotal response. It's a number of people just started to do that and went into PRT, and that the name that is associated with that is Kegel, Koegel. Those folks are at UC Santa Barbara. There's a Kegel Autism Center there, and they are it's sort of it's a style of doing ABA, so you can read more about that. And FBA, functional behavior assessment, is when a child develops a behavior or exhibits a behavior. It is part of that. This is not a type of ABA now, it's an assessment. So what it is it's you want to try to find the function of a behavior. So let's say a child might hit. There's many reasons why they're hitting. They could hit because they want to get an object from you. That's called tangible function. They might hit because they're trying to avoid something you told them to do. So that would be an escape or an avoidance function. They might hit just because they like the reaction they get out of you. That's an attention function. So there's different functions, and this is very important because for each of those you intervene in a different way. So if I'm hitting you because I want to grab an object out of your hand, then the intervention would be that you don't let the child get the object, because if they get the object, they will now learn that hitting was effective. If I'm hitting you because I want attention, I want to make sure that I don't give them attention, because if I do give attention, the child will learn that hitting got them attention and it was effective, and so on. So an FBA is a behavioral assessment that any behavior analyst will do in order to identify exactly why a behavior is happening, a challenging behavior or a behavior is happening, and to modify it. Okay. So that kind of summarizes things. You're beginning to do our ABA. You probably want to have a provider who can explain all of that to you, and I guess effective will be a provider that's doing a combination of something like discrete trial followed by NET.
And they're using skills, so
great.
They can be using skills to do all of these things. And if you need to, there's also consultation available with skills. You
Absolutely.
Can request it.
And good Lord, I don't know why I went through all that. You should just go on IBT and find the modules for all of these. There's if you look at Institutes for Behavioral Training, there you will find a whole module on what is DTT. You'll have a module on what is NET. There's a module on FBA. There's probably a module describing what pivotal response is. We don't do pivotal response, but at CARD we do everything else. And RDI might be under the other interventions section. I don't know. But okay. I mean, you'll really get a good comprehensive understanding of ABA.
I'm glad we got to go through that. But I now have 3 questions I want to squeeze into 3 minutes.
Okay.
Okay. Hello, and thanks for a great show. My adult son has been taking things that don't belong to him. I know he knows better and has never had issues with this, but any suggestions? He is of moderate intelligence, and thank you.
Gosh, that's a little bit hard. It really has to do, and maybe I can help you through this weekend. Next week you can answer some questions for me. What happens when he takes things that don't belong to him? Is he getting to keep them? Is he getting punished? Is he getting away with it? What happens, and what are these things exactly? Are they things that are very meaningful to him? So, theoretically what you would do is you would make sure that whatever it is that he's taking that doesn't belong to him, if it's something that he really wants, you try to give him access to that of his own. In other words, let's say it's some sort of toy or candy or I don't know what, you would make sure he has his own. And obviously, if he takes something that it doesn't belong to him, he has to have a response cost, so some form of punishment, or take something away from him when he does that. I don't know if his I really don't know if his functioning level would allow you to explain to him things like what are the wrong and right, and that you don't want to do things that hurt other people. So,
but send us in some answers about what the consequences are so we can address this at the top of next week's show. Next one. Hi, ladies. I have 4 children, 2 typical and 2 on the spectrum.
God.
They all push each other's buttons constantly. I'm sure they push your buttons too. And she goes on to say, I'm going out of my mind.
I don't blame you.
Yeah. Is there something I can do at home to help them to want to help each other, or at least be nice to each other? I don't expect them to all be angels or for the boys to stop being physical, but there has to be something we can try. We had a marble jar, but that didn't work. I'm desperate for advice. Thanks.
Honest, you need help. Like, I can't even, I don't know how you're functioning right now. Yes, of course. You can set up like little task charts for each one.
They have apps now that you can do.
Absolutely.
That reward them.
Yeah,
totally. And they can pick their reward. There are crazy apps out there about that.
And I don't know if kids, depending on the age, whether they like apps more or just the visual, physical thing on the wall, but when you're in the middle of chaos, setting up any kind of token system is just not going to work, because there's too much going on and they're getting away with stuff. Because once you set up a token system, you have to have the ability to follow through. In other words, if there was a marble jar where they received a marble for good behavior, but it was complete chaos, either nobody was receiving marbles or they were getting marbles even when they had sneakily done something. You know what I mean? So it's like you can't manage it. So what I really suggest you do is please try to get help. I don't know where you are, but wherever you are these days, it's possible to get help. So, if you're in California, the very first thing I would say is you need respite. Right. If you're in another state, you really should hopefully be getting ABA for your kids. Most states have coverage now. Write in and tell me where you are, or let us what state, what city, and then we can try to get you actually some help. Because I think if nothing else, you need to get a babysitter who goes through IBT and gets some basic behavioral training in order to assist with managing them.
Absolutely. And our last one.
And then of course we would help you set up a token system. Another thing you can do is go on the IBT modules, Institute for Behavioral Training, and look at the token economy module, because that will help you with things that are similar to a marble jar.
Yeah, because token economies only work if you work it the right way.
Exactly.
So iBehavioral Training, there is one just on token economies. Okay, and the last one was a follow-up about the unexpected crash, bang, boom, what the behavior was, the freaking out.
Oh, yes.
They're friends of ours from Florida, and they said that it's anything unexpected becomes negative or bad, and that what she does is throw things. That's what her freaking out is, that she throws things. Is there anything you would change about your answer knowing that?
Totally. I would set it up. So I would set it up and prevent her from throwing things.
Okay.
So you have someone who's your Confederate do a startling noise. You know about it, but she doesn't.
Right.
And then you're standing close enough to her that when it happens, you block her from throwing something. You prevent her from throwing something, and then you reinforce the non-throwing behavior.
All right. So, love that. Fabulous.
Yeah. And in fact, you might actually want to teach her something. And what will happen is the minute you let go, then she'll try to walk over and throw something. Throwing, remember, is usually treated with overcorrection, which means you will go back and forth. If she throws something, you go over to where she threw it and dump 50 more things, and then she has to keep bringing each one back.
Ooh, okay. Yeah. Not fun. All right. Thank you so much.
Sure.
We didn't get to all the questions, but we will be able to answer some of them tomorrow with some of the experts that we have tomorrow, and we will continue answering them next week.